let's talk about body composition and how we actually measure it. There are a few commercially available options out there regarding body composition analysis, but only one gold standard. The goal for my patients is really for them to have lean muscle mass percentage and bone density percentages of at least the 75th percentile for their age group, and as low a percent of visceral or intra-abdominal fat around the organs as possible. So how do we track this? Well, there's three basic options available at this time. The gold standard by far is the DEXA scan, which uses low-dose X-rays. There are devices such as the STIQ, which uses imaging from photographs, and then devices such as the InBody that uses bioelectrical impedance. Certainly each body composition measurement method has its advantages and disadvantages, but DEXA is considered the gold standard due to its high accuracy in measuring body composition, including bone density, fat mass, lean muscle mass, and visceral fat. STIQ and InBody are generally accurate, but have limitations in differentiating between specific body tissues with the same precision. They also cannot tell us at all about bone density or about visceral fat percentage, which is the bad fat that surrounds our intra-abdominal organs and intestines. This fat is very predictive of the development of metabolic syndrome, diabetes, and cardiovascular disease. All leading longevity experts agree that STIQ or InBody are not as accurate or data-driven for longevity medicine. They're great for gyms and personal trainers, but obviously in medicine, we're aiming for the gold standard for diagnosis. DEXA uses low-dose radiation, and you might wonder, well, radiation is bad, right? Well, DEXA exposes us to about just under 0.03 millisieverts. Millisieverts are how we quantify radiation. For example, a chest x-ray is about 0.1 millisieverts. Radiation exposure just from living in a high altitude like Denver is about 0.8 millisieverts for the year, and a CT scan of the whole body would be about 10 millisieverts. The average American gets about 6.2 millisieverts of radiation exposure from all environmental causes. So the small amount at less than 0.03 millisieverts from the DEXA isn't really moving the needle. And medical experts agree that this is completely safe, even if repeated several times a year for the purpose of tracking. So DEXA shoots an X-ray, and that X-ray is absorbed through different body tissues at different rates. And it's different for muscle tissue versus bone versus fat. There's a detector on the other side of the machine that sees how much X-ray actually made it through the body. This allows us to know the exact distribution of our body analysis. STIQ relies on 3D imaging. It combines circumferential 2D images into a three-dimensional image, and using a computer algorithm, they extrapolate a person's muscle mass versus fat composition. And this is not a direct measurement. They validate this against the gold standard, which is DEXA. InBody uses bioelectrical impedance. This means that the InBody scan is utilizing a low electric current, and it's calculating the amount of resistance that there is to that electric current through metal sensors, and the current is traveling through our body. The scan essentially involves that current moving through our body, the fat tissue versus the muscle tissue, and it calculates what it believes is going to be an accurate amount of lean muscle mass versus fat mass. Again, they validate this against the gold standard, which is DEXA. So these all have kind of slightly different use cases. DEXA is really the preferred in a clinical or research setting because of its precision and the ability to track through all body tissue. STIQ and InBody is really much better suited for gyms and personal trainers. They're obviously not invasive, but they do have their limitations for bone density and visceral fat. We really want to be able to compare patients to age-matched cohorts, and that's something that we have tons of data with the DEXA. We're able to know where are you in comparison to someone your own age group, and where should you be. All of these methods have relative relatively good, reliable results. However, they are all prone to some misinterpretation based on hydration status. This is largely mitigated if you come in at around the same time of the day with about the same hydration status. The other issue is really cost and accessibility. Obviously, DEXA scans are more expensive, and because of that, they're limited to more medical use. STIKU and InBody are usually found at fitness centers, but at MD Longevity Lab, we want our patients to really have access to what the gold standard is, and that's why we use DEXA scans.